So allow me the opportunity to introduce our guest, a frontier functional medicine doctor who boasts a very impressive resume. Having graduated from Palmer Chiropractic College, but also having a naturopathic degree and a PhD in clinical nutrition, and been in practice since 1981. He has a very successful clinic, Diverse Health Services in Novi, Michigan, where he is famous for and distinguished for his staggering results with chiropractic and the intelligent, and I'm going to really emphasize intelligent, utilization of whole food supplements. It is truly the highest honor I could possibly have to have Dr. Randy Tent, my friend and mentor, with us today.
Thank you. I am unworthy, but I appreciate the introduction.
How do you, patients all over the globe, you got patients in Australia, everywhere. How do you get such a fine reputation, sir?
I think it all started out with children and this thing called YouTube. I was doing simple lectures in the past, then they got filmed for the office, then they got recorded, then they got passed out at the office, then they got uploaded, and then things went crazy from this internet thing, which thankfully Al Gore invented a few years ago.
So I've had many great men. I know you just said you're unworthy, but I want to set the record straight. I was a Marine for 8 years. I've had the privilege of knowing many different great men through my life, from lieutenants to generals in the Marine Corps, brilliant practitioners, brilliant PhDs. None of them can hold a candle to you, sir, and the knowledge you bring and the message you're trying to send out there in a world so chaotic and actually full of lies. So I really commend you, and I really thank you for all you've done.
Thank you. Thank you. I appreciate that.
So I want to ask you, a seasoned, fully awake doctor, and it was even pointed out by Reddit how awake you are, right?
Yeah, that was funny.
Yeah. So I wanted to ask you, as a seasoned practitioner who has seen literally everything we can imagine, and probably plenty of scenes we can't imagine. Is there something going on with the people today? Is the public becoming unraveled, and what's contributing to this?
I can't, it's the perfect first question to ask. When you try to play basketball with your phone and you get a little crack in the corner. We went to the Mac store Sunday, me and my wife. I'm standing in the Mac store looking at the crowd there, and what came out of my mouth I said to my wife, my God, this place is a human zoo. It reminded me of a zoo of people. They look like a confused bunch in my life. I have to be careful how you say things, but it was that mush of humanity. There was men that kind of looked like Marilyn Monroe. There's women that kind of looked like everything was the opposite. And I just blurted, I said to my wife, look at what the chemicals and the poisons have done to humanity. I'm not at all, when I talk about these things, I'm always quick to say, I don't think a lot of people really had the choice with some of the things done to them. And when an awake fellow like you, which I know you're very awake, I'm going to tell you straight up, you can watch how a lot of these men's political aspirations are, because they're attracted to things that most men, I don't think, would normally be attracted to. Certain candidates, certain beliefs, it's just not a men's thing, and you wonder how it happens. And from you guys watching my last lecture, when I was walking through 12 Oaks here, they took that sign down in that store where menswear meets femininity.
Wow. Yeah.
And it was gone. I mean, it was really gone. I'm like, I don't know what happened, but when I blew that thing up, I don't know what happened, but I'd love to know, because I jokingly said to the
There's
crowd.
No hockey stick. There's no hockey stick in there, right?
I'm looking for a hockey stick. The guy, you're in the wrong store, Bob. But I mean, that's my lifetime mall, and that's gone. But I'm quick to point out, I think a lot of mischief's been done, and it's been done so slowly and subtly. We can't really fault the people that have been fallen victim of it.
So what's happened to the men today? in a nutshell?
Well, if you watch the kids, let's think about this. To watch that little chubby baby come in, he couldn't suck on that plastic pacifier any harder. Right out of the chute, I got a plastic bottle, I got a plastic pacifier, and a boy. Right out of the chute, we've trained our kids to absorb plastic. And on the wall here, I just took a man, and it's his PSAs on the wall, and believe it or not, his name is Gabe. His PSA went from 1.1 to 1.5 after in a very short period of time wearing a plastic bite splint. They put a splint in his mouth. His PSA took quite a jump in a very short period of time. They didn't know why it was, and he said to me, because he watches the lectures, this happened after a plastic bite splint. So to watch the you know, and I know you're awake when you talk about this microplastic thing in the oceans. If you're not keeping your system up, I believe you're losing ground today. I don't think, to me, 10% of people out there are genetically healthy. They could survive the concentration camps, the gulags. They just can't. I'm not one of those. I'm going to be dead in a week, I think. I don't know how well I can handle that. But my point is, most people have to work at their health. They just can't expect it to be like our parents did, because that generation, that's gone, I think.
Yeah, I agree. And I remember what you pointed about your father sitting in the audience who had actually a better resting blood sugar than you did. And that really stuck with me, as you're a full out hockey player, and yet sitting in that chair, his blood sugar was a little better than yours. And it has to do with this. Every time we're generating and we're having children, and we're minerally deficient and nutritionally inadequate, we're just going to start falling apart at the seams, right?
Absolutely. Absolutely. With the public, when you and I are here trying to peddle supplements to people that think that the pharmaceuticals are the answer, not filling yourself up with the proper minerals, you're going to absorb the environment. You don't want to absorb the environment. You're absorbing stuff in similar oxidation states. Things look similar. If your body doesn't have zinc, it's going to grab the closest thing to zinc, and it might be a metal. And it might be a heavy metal. I mean, it's not conducive to the body. Like, for example, selenium. They thought selenium was toxic till like 1980. Selenium methionine is one of Zorex's great pills from Biotics. And how do you replace that? They thought chromium, people think chromium is something on a bumper. Well, no, there's different oxidation states of chromium. And we need some to make our pancreas work, and you need some to shine the bumper, but it's still chromium. And you might get a cheaper state that you don't want if you don't get the one you need.
Yeah. And the oxidation state's really important. I remember you talking about arsenic in pregnant women preventing a miscarriage. And you get arsenic from pine needles, but it's the oxidation state that matters. And I remember, I think it was a +2 that'll kill you, and a -2 is prevents a miscarriage.
Yes.
So the oxidation state matters. Okay.
Awesome. That is interesting. I find that oxidation stuff, it's just, well, my point is, looking back, we had an ignorant education.
Mm-hmm.
We just had an ignorant education. And you start to realize all the things. I mean, like I said right here, this is what it looks like. The kid with the best insurance in the neighborhood. They took great care of my teeth. That's my mouth.
Yeah. And I've seen that, and I've talked about it for ages. And I've seen it many times with some people. I had a child come in. One of my first home run in practice was a child that had severe neurological twitches. And his dad was a hotshot attorney, so he had the best insurance. And they did a number on this poor kid. And finally, when he came into me, I quickly said, he's got parasites. That's the problem. And their parents were a little skeptical until he passed a cup of ramen noodles in the toilet and his twitches completely stopped. And that really got the mother's attention. She blew my practice up after that in a good way.
Isn't that exciting?
Yeah. So how important is it in this day and age today to keep your health?
Today, when they say that 70% of the people are a paycheck away from a disaster, and people living check to check, I don't think you can afford to get sick today, especially if you got a family. you can get derailed pretty easy today from things that you should have. Like, for example, you know, my hockey league has had, like I said, it's had a rough year, and the injuries are getting younger and younger on the people. My coach had his knee replaced last Thursday, Tony. He's 53. It's his sixth operation. And I sit with all these rich white guys in this white collar men's league, but I keep my mouth shut because they think their insurance cards has helped them. And I look at the train wreck, and if I said one thing about why I skate 4 nights a week at 61 like a beast and take names, does insurance cover this stuff? No. I've actually paid to stay well. I've seen one of the judges here, great guy, and he said 10 surgeries. He looks like a shell of a man. Mm-hmm. I watch what these guys, they're aging so quickly. I don't want to look like they appear. I don't want to feel like they look. Yeah. Being put out, you heard me talk about that general anesthesia thing, 6 or 7 of those, your brain's going to start the big drift that you're going to have trouble pulling out of.
Yeah. So what do you see happening in the next, I mean, here's the thing, Dr. Tint, you're light years ahead of everyone around you, your thinking process and realizing the BS of this mask, this cloud that we're all in. What do you see happening in the future healthcare system right now?
Well, since this is a new sheriff in town, it's funny that you said that today, because there's a person online I was reading about this morning early that was complaining about the price of pharmaceuticals. And somebody answered them, like, how far behind are you? Don't you realize we get in the van every year in Minnesota? We go to, and they named a town in Texas on the border, and they're buying all their medications for 4 cents on the dollar. They store up their inhalers, they get their albuterol, whatever nonsense they've been told to take. And the prices that they were listing this morning, it's going to collapse on itself. The money that they charge is for nothing. These things cost cents, 0.0 some cents that we're paying $140 a bottle for. We can't afford it to continue on. And if the current president has his way about it, things are going to change here, because the vaccine things are going to be brought into question. We can't keep funding this vaccine where we can't lose all the children. That's a problem. Yeah. The vice chairman of General Motors wanted me to run GM's health thing as a pipe dream. We jokingly talked about that. He asked, what would you do if I put you in charge of General Motors health program? I said, well, it's simple. Anything that causes more diseases than it fixes, we're not doing anymore. I can't put you on birth control till you get breast cancer. I'll pay for your birth control. I'll pay for your breast cancer. I can't pay both, one or the other. Too many things are causing too many problems. The short-term gain is not worth it. We have to find shortcuts for idiotic diseases that I can't afford to deal with later. You see the same thing I do. I had no clue when I started in practice that the number one reason my patients lost their mind was because they lost their digestion. Yeah. I never saw this coming. I thought all the articles, the internet geniuses with all the heavy metal stuff, it has to be heavy metals. No. And I know you sent me messages that said it's simple digestion. Yes, it is. People they're starving to death in front of us. And maybe their body's lucky because the stuff they're feeding them is not any good anyway. Yeah. But you got to have stomach acid. You got to have that to absorb everything, or it goes right downhill. I'll never forget. And I've seen a couple of those myself. Hair analysis of people that have dead stomachs and they just are tanked. They can't absorb anything. No. It's the commonest Alzheimer's patient walked in. I just tell the patients, well, your lovely grandpa starved to death right in front of you for the last 40 years. Yeah. Zantac or Prilosec or something else. 450% increase in dementia with antacid use, according to the literature. It's unreal. During an interview, now I'm going to kind of change gears a little bit. I want to dive into this a little bit more. During an interview a few years ago with Joseph Sikora, you mentioned a change of path, 7 weeks into chiropractic college that changed everything. You went to an off-campus seminar. Can you elaborate a little bit about what happened and what kind of caused this drastic change in the way you run your practice? Well, I was 7 weeks in the school. I was 19 years old. I moved in with three old guys, Andrew, Duncan, and Ralph. New Zealand, Australia, and a guy from California. And they were like 30. And they were the old guys. I was 19. So Ralph, the California dude, said, get your checkbook. I'm going to take you to this seminar downtown in Davenport, Iowa. And I watched a guy by the name of Jeff Slocum demonstrate Versandal's technique very confidently. He diagnosed, he treated, he adjusted, things got better. The men that were good at Versandal stuff had real confidence in their way that the other folks didn't seem to have. They knew how to adjust, they knew how to find things, they knew how to check things. And I told people, the doctors, if you master the skeletal system, turn the body around and go after the organs, and you can have a whole nother practice when you learn to test the organs. Simple testing. I don't know if you know how this technique supposedly started. Versandal had a bad stomach, and he caught a guy by the name of Dr. Chapman. Versandal was a young practitioner. His stomach was a horrible mess. He was going to get out of practice. He couldn't. He went to a guy was doing a seminar on Chapman's reflexes. That's for some of the doctors can look at. He had a very crude, simple muscle testing technique. He checked Dr. Versandal. He said, you have a hiatal hernia. He put him on, pulled his stomach down. He was instantly fixed. It changed Versandal's mind. And I had one of those this morning from Flint. The guy couldn't shut up about how much his life changed, pulling his stomach down. So Dick apparently got every Chinese Oriental thing on acupuncture, all the reflex tests, tried to look for some similarities, started to put a testing technique together. Now I got to clarify, because he's gone now, Dr. Versandal had that very busy lithium brain.
Yeah.
He had that chattery brain that half my relatives had. My Uncle Wally had that brain. When you turn those brains loose in the right direction, they can be brilliant. If you turn them loose in the wrong direction, they can be troublesome.
Like what they did with Robin Williams, right?
Exactly. He tried to drink to stop his little chatterbox brain. So Dick had his brilliant moments, and I caught him, and I think in his most brilliant time. But the confidence that left me with, when I walked in the clinic, the clinic doctors were ridiculously impressed. I remember his name was Dr. Bruce Edkin, was my first adjustment. And my simple Versandal testing, I did what I don't adjust any different that first patient than I do here. People think I have this cosmic adjusting. It's the diversified Palmer package. It's just on the right spot. It's amazing what the right spot can do. People think I'm doing magical adjusting. No, this is just what I learned in school. The muscle testing taught me how to do it.
Excellent. I love it. That's where I want to go. Because here in Kansas City and Wichita is the same way. Wichita, Kansas, I was recently there. There's chiropractors on every street corner. There's chiropractors everywhere. My question for you is, why is our population so grossly misaligned, even ones that see chiropractors? Because I have the same problem.
Mm-hmm. I think this is, it's a very good question. And there's a real simple answer to this. A real simple answer that people, you walk through the mall, you look at these people, we all look the same. No, we're not. When I look at the difference between me and my father, you're watching generational starvation. I like to use that term because everybody's getting weaker than the generation before them. Like at the last lecture, when I put that crooked spine up, my ethnic community, I have a huge ethnic community here. And these people, they're lovely people, but they got some funky diseases because there's too many in the one pile.
Yeah.
And your generational starvation is a huge thing. People are being born starving. I mean, I got people coming in here, these ethnic communities. How come I'm sterile? Well, nature's going to finish you guys off one way or the other. If you don't mix up the pile, you're going to end. That's why, you can see the same thing in the animal industry. Is where I learned a lot of stuff from, because they don't have the, the chemo that the other guys, what are getting it now. But the animal industry, we have Michigan State's vet school here, and you read Richard Ulrich's book on minerals for the genetic code, Charles Walters. I mean, the guy's a genius. So learning that stuff.
And I remember when you pointed out, you pointed out that muscular dystrophy was cured in the 50s with that toxic selenium, right? It was a white muscle disease. So, yeah.
You have vets as patients. So anybody that's a doctor, ask your vet patients, do you guys have muscular dystrophy? I've had 7 vets in 38 years. And I ask everybody that question. They just laugh. I got rid of that so long ago. How come we don't know about that? They just laugh.
Yeah. Joel Wallach, Dr. Joel Wallach can point that out very distinctively about how the healthcare system for animals would be too expensive. So they decide to give them pellet form, crude minerals, fat, protein, all the stuff they tell you not to eat. And it wiped out 900 diseases or so in the animals.
Yes.
Unbelievable.
And we got to get to the point where when our GDP is about 20% of health, it has to collapse on itself. But you and I know that no matter what happened, the medical community was allowed all these increases, and how everybody got paid, me and you were left behind. So we get cut with all them. We were 1% of the budget in the first place.
Yeah, that's ridiculous.
Yes.
So you have mentioned before, kind of back to this muscle testing, you have mentioned before that everyone thinks they can muscle test, but most people can't. And that is something I completely agree with. I find it to be very true. Could you elaborate a little bit on why not everyone can muscle test?
Well, number one, that's a very good answer. When I went to school seemed geared to those analytical minds, those mathematicians, the Indians. I got a ton of Indian patients. I'm like, look, I cheat off your paper all day. I don't want you to be my doctor because I don't think you understand. You grew up taking herbs and spices. You learned this whole toxic poison way. Don't ask a single question and treat it like as if this is what you were doing growing up, and it wasn't what you were doing growing up. You're not thinking through this thing at all, because I can't believe how simple you could play along with stuff that makes no sense. So, studying yourself out of this is kind of what, if you're not doing that, my mother helped me with. One day, I wish everybody could meet how simple my mother opened her son's eyes without much, really wasn't much at all. Just being awake, realizing that things are not making sense.
Yeah.
So I think, how does nature work? I got to treat somebody how nature works. Pushing uphill doesn't seem to work that well. I got to go downstream to get rid of stuff.
Yeah, exactly.
And as I learn more and more, it's not how people respond. Just the sad thing is, everybody's so broke down today. I think I talked about this yesterday, which is discouraging to me. When I go out in my life, there's like 25-30% of these people, they're so broke, they don't even care. They don't care that they're dull. They don't care that they're vacant. They don't care that they're sick. And if I talk about what I do, they just laugh at me. They're so content with how broke down and lame they are, and they don't even question any aspect of this or have any drive to get out of this. I find that amazing.
I know, and it's kind of odd you say that. I think Dr. Russell Blaylock said it best when he said our society's chemically dumbed down. I happened to be in a spin pizza restaurant the other day with a friend who's his birthday, and I let him know. I said the testosterone in men is gone. So nobody's fighting for the country. Nobody's fighting for their families. Nobody's protecting their kids anymore. And I said, do you realize? I said, I get all my clues from nature. Do you realize what would happen if you went into a group of chimpanzees and you grabbed just one male out of there? It doesn't have to be the alpha. You grabbed one male out there and somehow communicated to this male chimpanzee that all his children were about to be poisoned and his entire community is about to be destroyed. He would go rile those males up and you'd see them start banging branches and you'd hear this loud, thundering, fearful noise coming out of it. Well, if I was in that pizza store and I stood up and said, by the way, 1 in 36 kids has autism today, and they're saying by 2035, 70% of the population will have cancer, and we'll be at 1 in 3 kids with autism the way this train's going. are we going to do something or are we going to sit down? All the men would go mumble and sit back down. It's the same
Right.
thing you're talking.
And the why is an album. Aren't you going to do something about this?
Yeah. Oh man, I tell you what, I don't know how many, I've got patients from all over the United States, and I Skype with these women and I let them know, the testosterone's gone out of men. Are they yelling at the football game, or are they trying to do something to protect the kids from getting sicker? And she's like, yeah, they yell at the game. And here's what one woman told me: I don't even feel safe with him anymore. That tells you everything. The alpha males are gone. There's very few of them.
I grew up, I was kind of an athletic partying dude. I was an athlete first and a hippie second. So I was a jock hippie. And if you asked, I was a lover, not a fighter. Now at 61, I'm like a fighter because they've lost by default. I've transitioned into being the tough guy, and I was just an athletic dude. We're losing the battery right now. Oh well, we gotta plug this thing in right now. Oh, good. Just like that.
Hey, you're still a fighter just because there's testosterone left in you. And I've heard many times you talk about hitting a hockey player or something that's 18 or 20, and they're like, ow, you hurt me. And you would have never imagined this in your 20s being able to play. And
and to say that,
what's it doing?
To say we lost him, he's coming back on.
We lost him. He'll be back on very shortly. For those of you who are still live with us, it seems Dr. Tin and I both don't know technology, and that's okay.
Here we go. Here we go.
all right, sorry, something happened. We're back. Stress. Okay, we're back. Next, where was I?
Men, testosterone gone. No one's fighting. You're still fighting at your age versus, you're a lover, not a fighter, and now you're fighting. It's because you still have testosterone left, and the rest of it's, gone. The plastics, the estrogens, everything sucked it out of men.
Now, I want to make sure you got I'm going to get the volume up. Okay. Now, the questions you're asking, great questions. And I know the thing I want to bring up very importantly, and I know you understand this for the people watching this, you have to clear this stuff out of your body. We're all getting pounded with it. The stuff the kids are eating are not clearing out the chemicals from their body. And you see them filling up with the chemicals. They're puffy and swollen because they're full of estrogen and plastics. Pizza, bagels, hamburgers. I grew up on that. I thank God that my body works as good as it does because I didn't have any of the right stuff, and I'm grateful. But as society moves on, you can't be raised on this food. Gordon Food Service is wearing the people out now. It's just not strong enough for them. So to make sure that liver, now you and I, you look like you're in great shape. A guy at hockey said, Tent, you're the last guy. You after the game, you're undressed, you rinse off, you're dressed. How come you're moving so fast? I said, I just sweat out all this poison. Well, you guys let it all soak back in. He looked at me and said, is that why? Do the kids sweat today? Have they run around the backyard? No. So sweating is huge. I try to tell these poor kids, find a way to sweat, an infrared sauna, open that detox pathway in the liver. And the most important thing that the doctors need to know, Antacids, antidepressants, and antihistamines block that liver. So when you see me talk about that stuff, I'm gonna tell you something. When I talked about that detox pathway that the entire world learned from, it was this stupid book. It was about a book about Prozac from 100 years ago. It talked about getting drunk driving tickets and that pathway being blocked.
And your judge in your community, you have a judge in your community who's fully aware of that now. And whenever somebody gets a DUI, doesn't he ask the first thing is, what medications is he on?
Yes, well, Judge Powers was in the audience. I said, Judge, what's the highest blood alcohol you've ever seen? He said, 5.3 or 5. I said, did it make any sense? He said, no. And I explained this to him. We had a famous case here, the Wellinger-Weinstein family. This guy was blind drunk and killed 2 kids and a mom on the way to an orthodontist appointment. He was blind drunk at 2. So this whole case went on. It was a big deal. And I treat patients in that courtroom. And it's funny that the guy that had the 10 surgeries is the judge. And I treat the people in his courtroom, but not him. And I got the transcripts from that case. He was on a Librium and an antihistamine. A Librium will take 200 hours to clear the liver. So any booze that you drink, you could get drunk 3 days later because that Librium was in the alcohol pathway. So a simple antihistamine and a Librium. And my patients are at the judge's desk going, Judge, look at this. He said, oh, Powers believes in that junk. I don't believe in that. Now I'm playing hockey with the guy that handled that case, the Wellinger case. And he's kind of a crabby dude. I haven't want to say anything, but the whole thing, how do you get blind drunk at 2 o'clock if you're a 57-year-old businessman?
Yeah.
You didn't even know what you did. So my point was the medications, that's the estrogen pathway. That's that kid, Mike's daughter with the tremors from taking Claritin playing soccer. Here she sits with her tremors. Well, you're taking the wrong medication to run around on toxic lawns. Fork vociferous complex. It took 4 months for tremors to stop. Look, Dad, my tremors are gone. That's how touchy we are. You can feel the booze. You can't feel the chemicals till they get you. What's the matter with my hand? Well, maybe it's working at Macy's, taking Claritin to keep your nose from running, smelling that. I mean, when we went to the mall where that human zoo was, just to walk past those soap stores and those fragrance stores, I look inside, who can possibly tolerate this job?
And then you go in there and you ask them a couple simple questions and they're just like, because everything they breathe just goes right onto their brain.
Correct.
So
that blood-brain barrier, you've been a fantastic student. I don't know if I have many better students. You've read my stuff and watched well, because I think you're doing a fantastic job just by listening, how well you've grasped everything.
Well, I tell you what, I see it falling apart. And I've got 4 kids myself, and I have a unique background of being in the Marines and having an experience of going through a blue zone. I witnessed a guy 105 years old sprawl onto a horse, right around cutting coconuts out of a tree with a machete in his hand. And he had a big grin on his face. And that's always kind of stuck with me of, why is that happening there in these villages when they don't have your your pharmacy stores and your flu shots, and they don't have all this other stuff. And why are they living and truly living, And here, everyone in this building takes, half steps to get to the bathroom, and they're, 50s and 60s. It's just bizarre.
Well, you and I can boil it down to one thing. I got some great patients here, the Sasakis. They've been with me for 35 years. They spend a fortune on their health. They travel the country in their little motorhome. They just moved into the Henry Ford Village here that all the older folks, it's a great place to live. And she came back, she said, Dr. Tent, when we go there, everybody shuffles to dinner. And she said, and I'm looking around, and she said, and they're 15 years younger than us. I said, yeah, but they saved money all those years with all those poisons and chemicals and operations. You guys are RVing the country, spending big money on your health. You're still rich. You feel great. And all those miserly people broke down. She said, it's embarrassing. They're 15 years younger than us, and they're completely broke down. A generation became cheap because that insurance card ruined the way they think. It ruined the guys in my hockey locker room. It ruined my friends. 3 of my friends have defibrillator pacemakers. That's 110 grand. I'm taking my D, I'm taking my pills, I'm doing it myself. One of my friends, I buried one guy with Lou Gehrig's disease. He was full of lead. 3 podiatrists kept fitting him with the orthotics. I'm watching my friend walk. This is not an orthotic problem. His lead was this long. He died of Lou Gehrig's disease. People have been trained. If your insurance card covers it, it's good. If it doesn't, it's bad. So people are finding out the hard way. They're losing their life hard and fast young because little things got out of control. Those viruses get out of control. Those little infections get out of control. Those little lumps get out of control. Biopsies get out of control. The literature is right. You keep irritating that benign breast thing, you're going to get it all irritated in the future. We've tested ourselves to death. I mean, I grew up with the yearly physical. They can't even do that anymore. That opened up a can of worms that we couldn't deal with.
It's ridiculous.
But it's nice to see a weight guy like you, because you can go into the seminars. For Pete's sakes, too many of our health people have died young from things. I can handle a weird cancer. Anyone can draw a weird cancer. I watch too many guys going down. I don't want to name the names because they're big names of simple heart issues. We can at least handle the heart.
Yeah, the heart. Yeah, the heart responds beautifully to nutrition. Beautifully. Yeah. I don't think anything. And we've smoked cardiologists. This clinic smoked 6 cardiologists last year. Simple heart stuff, and the little lady can walk up and down the stairs now with carrying bags of groceries and everything else. And her cardiologist says, "Look, you were misdiagnosed. This is impossible. There's no way your heart function goes from 16% to 65%. Simple heart." Simple protocols and making sure the arteries are cleared up. And again, that Versandol technique for finding those artery reflexes is just incredible.
When I did that at 30, cleaning out myself and the change, I stuck with it. But like I said, that 10-week change, oh my gosh, how could I possibly be that plugged up? But I was, because the little things plug up. Always bring people around. The little things are what you're going to feel clear up. And always remind the men, the arteries in your penis are smaller than the arteries in your heart.
Yep.
More commercials on that than the other.
Oh, yeah. You think a lot of the stress, the statins, and then the xenoestrogens are a big problem with the men's testosterone level today, right?
Yes. My friend, I have a good friend, it's a truck driver. It's funny, my friends with the most common sense, I really enjoy my blue collar friends because those are the smartest friends I actually have.
Yeah.
And guys at truck said, "Randy, my penis is shrinking." I said, "Well, the truck driving food up and down the highways. I mean, you're a tough guy. I graduated in 75. We would fight in school. We're going to meet out behind the school. I mean, there's really not any, the girls might fight still, but the guys, they pretty morphed into a pretty passive group."
Yeah. No one's left to fight.
They're having a problem. The police are having a problem. Everybody's having a problem.
So I do want to ask another question. You mentioned that today's children, and I fully agree, and I think part of it has to do with the glyphosate inhibits that cytochrome P450. You mentioned that today's children, and especially adults, are unable to keep their detox pathway opened. And again, you grew up eating this fast food and stuff. There's been a change in the food quality, has there not? Since you were growing up eating that versus the food today. Is it possible for people to even get nourished from grocery store food today?
The thing that I did that I think made the difference was all this. We didn't have video games. We played sports. We threw snowballs at cars. We were running from the cops. We made tree forts. We dug cats into the ground. We were always doing something. We kept moving. And now as a coordinated chiropractor at 61, I watched the 20-year-olds. I could out adjust them in my sleep with one arm because they've never done anything mechanical, so they have no skills. So I mean, sweating, playing, I was able to detox that way to make up for the crummy food I was eating. And that Monsanto kicked in about the late 70s, early 80s. So I tell people, I had 0 to 30 without a lot of these chemicals that you had. I had, the pediatrician was bad enough, but when that Monsanto kicked in, people started getting chelated. We got to keep in our mind, this thing's a chelator. It's not a pesticide as much as it's a chelator. It's stripping my patience. I mean, a lady this morning, she was too embarrassed to film. She's going to come back and get filmed the next time. 7 days of Cipro tore her wrists up. Her hands are still swollen from a week of Cipro. And now you watched my stories. I want to pick up my thing for you here because I want to show you something. Here's the Vipers. Okay? Right there is Rick Dudley. He was the general manager of the Atlanta Thrashers. This guy was the banana man. This was the guy that I wanted to talk about. When I did my stuff with him, my adjustments with him, he came in. He went from the Vipers to Tampa, then with the Thrashers. I gave him the same adjustments you and I do. He looked at me and said, 40 years of chiropractors, and I just had my first adjustment. 40 years and 40 different chiropractors. I did the simple Palmer package. I like to do that little extensilizer. But to take these pros and adjust them for the first time, they were pretty excited about it. And it's just kind of disappointing that we're losing ground with not having our strong point.
Yeah, I agree. I always see people come in and they just came from a chiropractor and they come in to see me. And I do a lot more functional medicine, teaching people how to start digesting their food appropriately, things like that. But I do adjust everyone. What's the most dangerous subluxation in your opinion?
Without question, it's got to be the Atlas. Atlas, you get that brainstem pinched. 38 years, I know you've seen some of my stuff I've done with that. The gal yesterday, I just looked and she's here for stomach problems and one eye's pointing out to the side. That's the one we took a picture of. Remember yesterday? I just looked at her. I said, what was your delivery like? She said, I had the cord wrapped around my neck. I said, well, one eye's going off to the side. You're clumsy. Putting a 4-year-old kid's neck on straight and have all their sinus congestion stop. It's not an infection. The kid's sinuses can't drain because the head's plugged. It's the one-sided MS, the left-sided stroke. Have the old lady come in. She wakes up in the morning. Her Atlas is out anyway. It's been out forever. She's just used to it. She falls asleep in a chair. She wakes up. She's half numb. Oh, my gosh. I've had phony strokes come in. It wasn't a real stroke because Versandol's reflex was quiet.
They're quiet. Yep.
Quiet. You get that, Alice? Now, I'll tell you, I don't like to say this, but I'm going to say this for you because you're awake. I've had to clean up that misalignment on a number of doctors that did it. Mm-hmm. I went to this guy ever since, and you jerked that Alice off the cord before this one old lady got thumped, and it was a big deal. And as I jerked her Atlas off, as she was getting off the table before she could stand up, will you be my doctor? I haven't done wrong. She couldn't even get up off the table before she wanted me to be her doctor because she looked like she had a stroke all night and her neck was out.
Yeah, I always see that. I can always tell when their Atlas is out because their right arm's strong and their left arm's weak. If you just simply test it, and more than likely their left leg is weak as well.
Their eyes won't be pointing straight.
Yeah, Reba McEntire, right? Shaquille O'Neal, right?
I know. Okay, 3 minutes. All right, the girls are giving me the high five. How are we doing?
We're doing good. Let me just say this. One more question. What happens when people, including children and teenagers, exercise, they do CrossFit, and they're eating all this empty food?
I think the best way I can say is watching let's say Donald Trump looking at Lou Ferrigno and The Apprentice. Lou, you look pretty good. Do you still work out a lot? He said, no, not much anymore, Mr. Trump. I've had both hips replaced, both knees replaced, and a shoulder replaced. What about you, Mr. Trump? Do you work out? He said, are you kidding? All my friends that work out look like you. He said, I don't do nothing. I feel great. But, Dave Peters just tore his rotator cuff. Tony had his knee replaced. Tom broke his leg. The ref fell and broke his shoulder. Jerry broke his shoulder. Tom dropped dead. I look at these kids and say, you might enjoy it now. You are going to age real fast with your joints. You're gonna tear up your knee. I've seen pom-pom girls in their middle 20s that looked like, I said, you better enjoy it because you lost half your knees in pom-pom. So saving money, living on Advil, aggravating the conditions, taking the pharmaceuticals, they've accelerated their age. There's a good chance that little chubby video kid will feel better at 40 if he makes it not being diabetic than that little athletic kid.
All right, Dr. Tent, one more question. I'm gonna let you go because I know you're a very busy man. You do
Yes.
Skype appointments all around the world today, and you've helped countless people. What's the best way for people to get a hold of you?
diversehealthservices.com, 248-477-0380. And Dr. Jeff and myself, we're just doing what we do. And, you know, it's the attention has been kind of surprising because I'm just a local boy here. And I appreciate all you guys, you know, helping.
We
grow.
appreciate everything you do. We appreciate everything you do, Dr. Ten. Okay, you guys keep it up. All right.
Thank you. I enjoyed meeting you for the first time. You're a warrior. I know you're a fighter. I'm glad you're on my side.
Likewise, it's good to have a wonderful mentor like yourself, sir. We'll talk soon.
We'll talk again soon.